Good day, friends of Buzzy. So I'm Dr. Amy Baxter, and as you know, when I am talking about something serious, I put on my doctor coat to go, yeah, check me out, I'm a doctor. Today is really extra serious, so I'm even breaking out my old stethoscope, how nicely it fits around my neck, to talk to you about 3 different aspects of coronavirus. First thing we're going to talk about is use of steroids. Second thing we're going to talk about is the new data on masks. And then finally, I'm going to get to the heart of the matter and talk about myocarditis and why going for herd immunity is not a good idea. The reason I'm talking about steroids today, when I've already spoken about it, is because I was talking to someone earlier today whose child happens to be at University of Georgia, where my children are, and they have come down with coronavirus. This guy said, you know, so I immediately called my doctor and got her some steroids, and so she's now taking steroids. Holy crap, this is exactly the wrong thing to do. This is the same place we were when people were recommending hydroxychloroquine without having a randomized controlled trial. Science works by trying things out. And so the best science is a whole bunch of randomized controlled trials coalesced into a meta-analysis. When you can't get that, one randomized controlled trial can do if it's done well. If you don't have that, then you can do observational studies, which are a lot of what they've been doing so far, which was retrospectively looking at groups that were on one medicine and groups that were on another and then seeing how they do. And then case control, cohort, anecdotal, those are much less strong. Here's the thing with steroids. You got to understand that with coronavirus, what is happening at different times dictates when treatments work. The only good randomized controlled prospective data we have is for a steroid called Decadron, and that steroid did reduce death. But let's look at when that steroid was used and talk about what makes sense. All right, so here is how the virus is working. So in the first few days, day 1 to 5, what you see there is that the virus is going up, viremia. That's how much virus there is in your system. So when the virus is going up, that's when you want to take antivirals. That's when you want to be doing your zinc, your vitamin C, your melatonin. If you were going to do remdesivir, that would be when to do it. But the thing is, at this point, you're at home. You are not even aware that you're sick yet. So by the time the virus has peaked, say this is when you know somebody was sick and you got tested and the virus is peaking around day 5, that's when your immune system is starting to get going. So by the time you're actually symptomatic, day 5, 6, 7, you're coughing on people, the virus load is starting to go down and your immune system's kicking up. So here's the thing. Looking at what happens at your lungs, this is where you're starting to have oxygen issues. But even with Decadron, what they found was that it decreased mortality 3.8% when it was given when you needed oxygen, but that was barely significant. What they really found a difference was the death was decreased with this steroid right up here. So when you've got late pulmonary phase, this is when you're in the ICU, this is when you're intubated, that was when Decadron helped. Here's the thing, your immune system is trying to cope, right? So if you've just gotten a little bit sick and you give steroids, then your immune system doesn't have a chance to do what it's supposed to do to fight it off. What they found in that one study that showed Decadron worked for intubated patients was that there was an increased risk of death when it was given to people who were not on oxygen, even though they were already hospitalized. Increased risk of death. I was on the CDC emergency guidelines panel, and when we were looking at what risk factors were for bad outcomes, having been on a steroid before being hospitalized, whether it was for asthma, whether it was for autoimmune disorders, whether it was for poison ivy, glucocorticoids is what those kind of steroids are called. Those in the previous 6 months made you more likely to die. So the thing that's going on with your body is that when you start getting sick enough that your immune cascade is going crazy, that's when you want to take a steroid to put out the fire. But if you had taken a fire retardant for the 6 months before, if you had steroids on board, it meant that you didn't mount a normal immune response, and those people got sicker. So just because we give out steroids like candy, I mean, I have Decadron that I had at home for croup, for asthma, for all sorts of different things, poison ivy. We're really comfortable prescribing them as doctors. Coronavirus is the wrong place to take it. Unless you're intubated in a hospital, I would not take steroids because you need your immune response to recognize what's going on. We think now that there's a subtle immune response if you've had coronaviruses in the past that is able to make your case asymptomatic. So if you've had 1 or 2 common colds caused by certain ones of the coronaviruses, turns out kids who've had common colds before aren't getting the crazy immune response, MCID thing, the sort of Kawasaki's disease. The only kids that are getting the Kawasaki's thing are people who have not had those coronaviruses before. So first of all, yay, guilt mitigation for sticking my kids in daycare at very early ages, but gonna bring home, you have to give the drugs at the right time. So early on, first few days, this is where you want to give antivirals, but do not give glucocorticoids. If you're in the hospital, if you're on oxygen, maybe, and definitely if you're intubated, get some steroids on board. But steroids are like a Chinook helicopter dumping water on your immune system. And the fact that we have so many asymptomatic cases shows that actually our immune systems most of the time are doing a pretty good job with this. So please, if you got steroids at home, if you keep them at home for asthma, don't take them if you get coronavirus. They're a hospital drug for coronavirus, not outpatient. Moving on. All of you know that I have a special place in my heart for masking. So as we talk about the immune system, it turns out that's really relevant for what we're finding with mask wearing and how that's decreasing transmission. So back in March, the concept was wear a mask. So during those first 2 days while you're sick and really viremic and have a lot of the virus, if you put a mask on, you're not going to breathe it out because we know that breathing out is how we transmit coronavirus. So wearing a mask before you're sick makes sense to protect other people. That's not necessarily enough of a reason for Americans to do something. So sometime after that, it became apparent that there's a lot of data on masking correlating with lower pandemic spread. So Southeast Asia, Japan, places where people wear masks all the time, their case fatality rate was lower, their spread was lower, and it became obvious that it's not just good for you not spreading the disease to others, it's good for the whole community. This gets us back to work. This makes everybody able to go get out of lockdown. That still wasn't good enough for a lot of people. Now I think we can definitively say that wearing a mask protects you enormously. 2 new things came out this week that are exciting about masks. The first was a publication in New England Journal that I've spoken about before when it was a preprint, but Dr. Gandhi at UCSF noted that before there was widespread mask wearing, asymptomatic spread was about 40%. In places where mask wearing went up to where 92% and up of people were wearing masks, 80% of cases were asymptomatic. So this brings us to a concept called variolation. Variolation is a very old immune concept that came about when smallpox existed. Before we had vaccines, people would sometimes take a little bit of the pus from a smallpox, make a little cut, and smear some of the pus in. All right, nasty, right? But the idea was that it was sort of a light vaccination, that it gave your body a chance to get a little bit sick, but to still have the immune response to beat it off. This is why you don't want to take steroids early. It's really important for your immune system to be able to see just a tiny bit of the virus and beat it off. It turns out that masks are what are making our asymptomatic cases go up, because what they're doing is they're decreasing the viral load. If you can't breathe in as much of the virus, you don't have enough to make you really sick and to tip over your immune system into getting really critically ill and needing steroids. So Goyal et al. Published a paper looking at a mathematical model of if a mask decreased the viral load by, it decreased transmission by 50%. So looking at masks that were only 50% effective at stopping incoming virus, what they found was even if it's only 50% effective, it actually decreased your viral load tenfold. And even wearing a 50% effective mask was still enough to bring the R-naught less than 1 to stop the spread. So that's why these communities where there's widespread masking are not seeing the kind of spread that we see in places where there isn't mask use. So viral load is a big deal, and not getting us sick and not leading to that immune cascade that's a problem. All right, so having said that, the concept then leads me to my third thing, getting to the heart of it, which is if we can make a light viral load lead to reduced disease, then why don't we just have all of our college students go put on a mask and get into a gym and have a rave so that they all get a light case and then they're immune and we're good, right? And then we let them go out in the community and take care of people. Here's the problem. And I have been thinking about, I've got 2 college kids. And I've been thinking about, well, golly, wouldn't it just be nice if they were like their friends who've already caught it and are done? And so now they're protected and now they've got their immune system. And here's the problem with that. Myocarditis. Turns out that SARS-CoV-2 has a particular affection for the heart. About 50% of healthcare workers in the UK who were positive for coronavirus, and only 16 of them were hospitalized. But looking at the cardiac MRI of these patients 10 weeks later, so way out, 75% of them had evidence of inflammation-itis of the heart, myo, heart muscles, so myocarditis, heart muscles. But 75% of them had abnormal cardiac MRIs compared to 5% who were not infected with coronavirus. So that's huge, that's enormous. And this is 10 weeks later. So what do we care about myocarditis? Well, when I was on that CDC panel, one of the things that we noticed early on was that troponins, which is something that normally we get troponins for people who are having heart attacks. And randomly we were getting some troponins on these people and they were sky high. And so high troponins was a marker for severity early on in coronavirus. We knew that. What we didn't know is that even patients with very mild disease who don't even get hospitalized are still very likely to have problems with the muscles in their heart. There is a frightening image. If you Google sarcomere COVID myocardium, I think, you will see these pictures of normally you've got these lovely heart muscles that are green and they're like this and they're contracting to make the heart beat. And they put them in a dish with some coronavirus and they came back 48 hours later and it looks like there's been a Cuisinart. I mean, no virus does anything like this. Now, to be fair, they also noted that the heart cells that look like they've just been pulverized don't look like that in real people. But in an autopsy series of 6 people that died of coronavirus, of pulmonary, non-cardiac, these were all people who died from breathing issues, 100% of them had messed up hearts that had just not been clinically relevant, but 100% of them had damaged heart muscles. So yeah, you may not know you've got problems with your heart and you may have a really mild case of coronavirus. It is far too soon to tell whether or not there are going to be issues down the road because of this. Normally, if you get myocarditis, they will follow you because it takes 5 to 7 years to get over the effects in the heart. And the effects can be sudden death, arrhythmias, heart getting bulgy and floppy and you needing a heart transplant. I mean, there are very serious consequences of myocarditis, and it's not like you know you're done if you make it 6 months. These symptoms go on for a long time. Early on, when we were looking at myocarditis in athletes, there were reports of 20 to 30% of people that had problems with their hearts. In a more recent cardiac MRI, it looks like these athletes who had asymptomatic cases, about 10% of them had continuing ongoing cardiac problems. 1 in 10 is a really big deal when it's your heart and when these are really healthy people. Of the people that die of coronavirus or that get very sick, we have approximately obesity, hypertension. So about 2/3 of Americans have something that puts them at risk of getting worse coronavirus. So of the people, almost 200,000 now, who have died in this country of coronavirus, yeah, most of them are over the age of 65, and most of them had some kind of underlying condition. But we're not really looking at the survivors, and we don't know enough yet. We just don't. So this is where I am on the whole college herd immunity thing. I am supporting my kids staying in their dorms, masking, risking getting depressed, risking having bad nutrition from eating pizza all the time, because I don't think it's worth risking the cardiology after effects and the problems with the hearts that we just don't know about yet. It's just too soon, and you just don't want to mess around with the heart. In review, kids, steroids, don't take them at home. Masks, wear them. We should all wear them. We can get out of this faster. Catching coronavirus just so you can be over it and not worried anymore, it's too soon to say. It's too much of a risk, and having cardiac problems and having arrhythmias and having sudden death are all very real possibilities, even in healthy young people, and it's not worth taking the risk. All right, well, I have done my little weekly update on coronavirus. If you have any questions, please put them in. If you want to see some of our previous videos where we've talked about what are the antivirals that you take early in the course, what are the drugs you should take when you're not sure if you have it yet, you've been exposed, what are the medications that make sense to take in the hospital before you're on oxygen. All of those things we cover in other ones. Like the video, follow us, and please stay safe. We're so close. Just a couple more months, staying home, masking. We will get through this, and it's going to be okay.